Okay, so Assalamualaikum warahmatullahi wabarakatuh, and a very good morning to everyone. I bid to our guest of honor and also students. Welcome to the Greatest Wealth is Health Day 1. We'll be having two very interesting sessions today. The first session will be a talk on mental health by Dr. Hur Azmi from Hospital Serdang. And later in the afternoon, after lunch break, we will continue with the art drawing House Tree People session. So as to bless this event today, let's start by reciting Al-Fatiha for the Muslims, and for the non-Muslims, please observe a moment of silence. Ladies and gentlemen, now we shall proceed with the first session for today's agenda, which is a talk on mental health. But before we continue with the session, let's get to know our speaker for today. Dr. Hur Azmi is a medical doctor with 5 solid years of practice experience at Hospital Serdang. She pursued her tertiary education in Bachelor of Medicine and Bachelor of Surgery at the University of Alexandria, Egypt. She can speak 3 languages, namely Malay, English, and also Arabic. She is currently serving as a medical officer in Psychiatric Department, Hospital Serdang. Without further ado, I would like to call upon Dr. Hur Azmi to deliver her talk on mental health. Please welcome.
All right, thank you. All right, thank you, our MC for today. All right, my name is Dr. Hur, and I'm currently working in Hospital Serdang. Today, I would like this to be a bit interactive. So if at any point of the time where you feel like you want to ask some question or something that probably you're not sure or don't understand, you can just interrupt me at any time, at any point of the time lah. Because I would like to be this as interactive as possible. So my topic today is kesihatan mental untuk semua, or mental health for all. Alright, before I start my presentation today, I would like to refresh regarding an article that maybe some of you have read when you're scrolling through Facebook. There's one article that mentioned that during this PKP time, alright, from March till November, total of 266 of people succeed in suicide. Alright, that is one of the recent article in, I think there's in newspaper and also spread in Facebook. So 266 succeed in suicide, not an attempt, or succeed, and this is a very an alarming numbers, okay, of death, because we know we already lose people for because of COVID, but due to the psychological impact or the mental health impact from COVID, cause some other death, not because of COVID, but because of suicide. And this is something that, well, I think everyone will feel like it's very sad and depressing, like if you think about it, because it's a death that is preventable. All right. So today, I would like to say that my aim of my talk today is I would like to introduce all of you, or improve your knowledge regarding mental health. All right, that's the first thing. I would like to a bit elaborate regarding the mental illness, common mental illness that we have, all right, usually have, okay, and how ways to cope, all right, or if we don't get the mental illness, how to help those who have mental illness, right? But my main aim is actually to stop the stigma, all right, to stop stigmatize mental health or those with mental illness, okay? Because if all of us will stop all this stigma, right, we can help other people, or we can save life. Imagine these 266 people, if they really get the help that they need, right, they probably are with us today. So this is something, it's sayang lah, it's a preventable death, right? So now I will start my presentation. Okay, how to click next slide? Can I, the next slide? All right, okay. So my presentation actually is from buku panduan kesihatan mental. We have a guidebook for mental health, all right? You can easily download it from internet, easily available. It's actually for Mental Psychiatric Association. They do it. Some of you kenal Dr. Hazri Zakaria, all right? He's a psychiatrist, okay? And he's very active in social media as well, also in TV, all right? So he's one of the person who do this buku panduan. So this buku panduan or guidebook covers most of the things of mental health for laymen to understand what is mental health or what is mental illnesses. So we cover what is mental health versus mental disorder. Then we would like to know what is the most common mental illness that usually people will have, the support from family and society, and also what are the proactive ways to actually manage our mental health. All right. So the next, so if today is a very simple one, but you can download it later to know it in depth lah. All right. So mental health. Okay. This is the next slide, please. Okay. What is mental health? All right. Mental health ataupun kesihatan mental. All right. We know that uh, health is something that is general, but actually we have physical health. All right. We have mental health. We have spiritual health. All right. So, and we need to have everything must be healthy lah in all aspects. For someone, we want to define someone as healthy. So sometimes, okay, not sometimes, most of the time, all of this influence each other. All right. When you have good physical health, your mental health will be good lah. If you have good mental health, your physical health will also be good. So it's interdependent. It helps each other. You need to be healthy in both ways. So what is mental health? Okay, it merangkumi, alright, okay, it involves the well-being of mental, alright, our mental, psychology, and also social. So meaning, alright, sometimes we if someone, alright, is not really socializing well, alright, or have problems socializing, that could also be a what is mental health, okay, alright, and then mental health will influence, alright, the way we think, the way we feel, our emotion, and our action. Alright, meaning the wellness, okay, the well-being of our mental health will influence even our thoughts, our feelings, and our actions. So if at one point that our thoughts are a bit disturbed or our feelings a bit disturbed and our action also is a bit disturbed, that just show that our mental health is somehow disturbed lah. Alright. Okay, so WHO ataupun World Health Organization has defined mental health as okay, kalau dalam bahasa Melayu, keadaan kesihatan di mana individu menyedari keupayaan sendiri. Meaning, mental health, that someone, in order for someone having a good mental health, that someone must have, alright, that person must know the capabilities of own self, alright, can withstand or cope or deal with the normal stress of life, alright, can work productively, and also can give back towards the society or towards the community. Meaning, untuk seseorang tu ada a good mental health, seseorang itu boleh dia tahu, okay, dia tahu ataupun yakin dengan keupayaan dia. Dia tahu that dia berupaya untuk buat sesuatu, alright, dia dapat mengatasi tekanan normal kehidupan. Tekanan normal ni is like contohnya bekerja. We know that bekerja pun ada stres sendiri, dalam berkeluarga pun ada stres sendiri, dalam bersosial pun ada stres sendiri. So benda tu memang normal lah, ada stres. So, kalau kita dapat atasi normal stres-stres macam ni, kiranya kita ada good mental health lah. Alright, and then bila kita dapat bekerja dengan produktif, when we productively, meaning we are functioning lah, okay, so that shows that our mental health is also good and we can give back to the community, okay. So it doesn't matter what are you, meaning what you work as, or are you, if you're a student ke, you can give back to others, meaning you are useful to others, you can help others. So that shows that you have a good mental health, okay. Alright. So now that is kesihatan mental. Okay. Let's say if someone punya mental health is disturbed, alright, someone's mental health is disturbed doesn't mean that dia ada mental illness. Okay. Sebab, alright, jadi kadang-kadang stres, okay, kita memang ada masa yang kesihatan mental kita terjejas. Contohnya kita dah penat sangat, alright, misalnya perkataan tu burn out lah. Dah lama sangat dalam keadaan stres, penat, okay. Kadang-kadang biasalah kesihatan mental kita terjejas for the time being, alright. But it doesn't mean that we have mental illness. So bila yang kita kata seseorang itu ada mental illness, when do we define someone to having mental illness, or we suspect someone to ada mental disorder? Because if we suspect someone ada mental disorder, they need help as soon as possible. So mental health, okay, ataupun kecelaruan mental, mental disease or mental illness, kecurangan mental is defined as someone tu, alright, dia ada perubahan or changes in terms of dia punya thoughts, changes in emotions, changes in behavior. Right, this is something that usually in thoughts and emotion, other people won't see. Right, kita tak nampak macam mana seseorang itu berfikir, apa seseorang itu tengah rasa. Tapi we can definitely see someone who changes through their punya behavior. So if one of these dah ada disruption or changes, okay, or or all of them dah disturb, alright, and all these changes cause this someone menyebabkan kesukaran, okay, causing difficulties for them to deal or cope with the normal stress of life and the normal routine. So ini menunjukkan yang kemungkinan besar seseorang ini ada penyakit mental. Alright, so we have a statistic here from Tinjauan Kebangsaan Kesihatan dan Mobility in 2015. Okay, in the study shows that 4.2 million Malaysian from 16 years old and above, alright, there's 29.2% who are actually having, alright, problems in mental illness or having mental illness. So that's the big numbers lah. It is in 2015. Actually, the latest one, I think 2019, they did another research. Okay, another research shows that it's increasing lah. Alright, one is because people pun are more aware. Okay, we already create an awareness, so people somehow started to find help. So that is why probably it's increasing. But also the stresses of life also, right? Macam like this year lah, the 2020 ni, it's some sort of a very challenging year, alright? So creates more mental illness lah. Alright, so now mental illness, I know that layman will, usually when my patient comes, okay, they will only know depression, alright, okay, usually depression, okay. Kalau tanya apa kemurungan, alright, depressed, alright, but actually we have 200 types of mental illness. That's a lot, eh. Okay, actually we have a book, DSM-5, where we use it to diagnose patient. Alright, there's almost 200, and the psychiatrists are now increasing if you know that we have one more new illness, which is gaming punya addiction, okay, also already included in diagnosis. It's a type of diagnosis juga. So we have lots of mental illness, okay? So not necessarily depressed je, okay? Alright, so next slide. It's very important to know the definition lah, okay? Okay, these are the most common mental illness. Like I mentioned before lah, we have over 200 mental illness, but definitely I won't talk about it. I won't talk about those 200s. But the most common ones are these 4 mental illnesses lah, which is the kemurungan or depression disorder. Then we have anxiety, okay, anxiety disorder. We have bipolar disorder and also schizophrenia. These are the 4 main diagnoses where people usually comes for lah. Alright. Okay, nanti later on I will elaborate further for each of the mental disorder. Alright, okay. So this is fakta dan mitos lah. Alright, facts and myth. Okay, there's a myth. Okay, when someone said mental problem don't occur that easily or it jarang berlaku lah. Okay, that's a myth. Okay, because 1 out of 4 people, alright, in the world actually have mental disorder or neurology issues at least once in their whole life. So it's quite common. Okay, it's not something, and maybe I think most of us are now more aware. We started to know some of our friends or some of our family members who actually seeing a psychiatrist. Last time it's very rare. Kalau orang Melayu kata dulu-dulu kalau ada orang tu ada perubahan dari segi mental or emotion or even behavior, dia kata okay, ada saka ke, alright, or dia disihir ke, okay, that is the mental culture punya perception, alright. But actually it's very common, okay, when we actually sit down and talk to the patient, find out that the person actually ada mental illness, alright. Another myth is mental disorder only adults can have mental disorders, right? But the fact is, alright, almost about half of mental disorders started from the age of 14 years old, alright. That's quite small, right? In form 2 dah start ada mental disorder. Or another myth is, alright, mental disorder did not give any effect to physical health. Alright, it's wrong lah. Okay, it's a myth lah. Because like I mentioned before, alright, it's interrelated. Okay, if you have a good mental health, you have good, it will affect you punya physical punya life. For example, imagine you are stressed, okay, or you are depressed, and you don't get enough sleep, alright, you don't have any appetite, okay, imagine what over a period of time, that will definitely give an effect on your physical health, okay. So the next slide, please. Alright, now we go to the causes of mental illness. This is a common question whenever I see a patient, okay. Usually the family members lah will ask when they come with the family members, they will ask, doktor, kenapa anak saya boleh dapat penyakit ni? Alright, is it adakah sebab dulu dia lahir lambat ke, demas dalam perut ke, okay? Alright, adakah sebab dia pernah jatuh masa kecil ke, dia pernah sawan masa kecil ke? So these are very common questions, okay? So actually we have a lot of causes of mental illness. There is no one cause of mental illness, and it's actually it's the same for all disease lah or illnesses actually. So the first one is pengalaman hidup yang teruk, okay, a bad experience or someone to having a trauma, or for example they have experienced childhood abuse, okay, or sexual punya sexual punya issues during small, okay. This can later on cause mental health issues or mental disorder, even mental disorder. And then pengalaman yang berkaitan dengan penyakit perubatan kronik, okay. Physical health lah, again I mentioned before, physical health can affect your mental health. So the same lah for someone yang ada chronic illnesses, right? For example like stroke, okay, cancer or diabetes, especially those illnesses yang affect you punya, alright, ADL ataupun affect you punya functioning. If you have stroke, you are paralyzed, you no more can drive, you depend on others to feed you, to bath you, so that will definitely giving you high risk to get mental disorder or definitely affect your mental health. Then we have biological factor. Alright, this is something that usually it involves genetic lah. Alright, genetics and also the imbalance of chemicals inside our brain. So sometimes or most of the times, okay, the imbalance cause everything comes from the brain. Even our feelings, our thoughts comes from the brain. So whenever there's some sort of imbalance, it will affect our behavior or our mental health. Alright. Then pengambilan alkohol atau das. Okay. Right. This is something like some sort of addiction. Okay. We know the bad impact of any addiction, whether it's alcohol, whether it's drug, or even nowadays like porn. Okay. All those, any sort of addiction can cause some sort of mental health issues, alright? And then kurang pendedahan or interaksi sosial, okay? Orang yang jenis tak bercampur lah, they don't socialize well, alright? They live alone, alright? They don't have any support, okay? That will again increase the risk of someone to have mental disorder. The next one is mempunyai perasaan kesepian or pengasingan. Again, it's quite the same lah, macam not really socializing, right? And then mental family history of mental illness, right? This involves genetic also. So all these are causes of penyebab penyakit mental. But if you have one of these, still doesn't mean that you're gonna have mental illnesses. But if you realize that all this is actually, semua ni is actually the things that creates or design our personality. So when we have one of these issues, okay, it will affect our personality. When our personality unable to cope with any issues, that will increase the risk of mental illnesses. Alright, the next one. Next slide. Okay, now we're going to understand. We're going to go through the four most common mental disorders. Alright, next slide. First of all, the most famous mental illnesses lah. Alright, apa-apa pun depressed. If you ever heard that someone pun cakap, kalau dengar suara depressed, okay. If bunuh orang, depressed lah tu. Okay. Kemurungan or depression is actually a very common mental illness. It affects around 300 million of people around the world. Okay, and it has been increased 18% since 2005 to 2015. All right, depression is very common that when you have someone have depression, it can affect job, all right, the studies, and also in terms of social. All these are actually affecting, kita kata affecting functioning dia sebagai seorang manusia. And then we have the facts that uh, women are two times more easier to get depression rather than men. Okay, this is based on studies lah. Okay, memang wanita dua kali lebih berkemungkinan untuk mengalami kemurungan berbanding lelaki. Alright, okay, next slide please. Okay. We have many types of depression. Okay, so no wonder when people kata, oh, depressed. It could be right, it could be wrong. But yes, we have lots of types of depression. The first one is kecelaruan kemurungan berterusan, right? Or depression, continuous depression. Okay, in our medical punya terms, we call it as dysthymia, right? So dysthymia is actually mood yang tertekan or depressed mood which ongoing until at least 2 years. Alright, then only we can see that someone is having dysthymia. Alright, so sometimes also, okay, those with dysthymia can also have, alright, major depression disorder in between of dysthymia. Alright, okay, so MDD or major depression disorder is another diagnosis. Alright, dysthymia is another diagnosis. But you can have, okay, superimpose MDD or major depression disorder with dysthymia. Alright, so in dysthymia, alright, the symptoms must be ongoing for 2 years for it to be called dysthymia. Alright, okay, and dysthymia in comparison with depression, MDD, okay, the dysthymia, depression in dysthymia, the symptoms of depression in dysthymia is much more less than those with MDD. All right. So again, only usually the doctor will tell you what kind of diagnosis you have lah. All right. The next thing is postpartum depression. Okay, this is something that when someone delivers, okay, it's actually common for us to have what we call postpartum blues. Okay, if you ever had a postpartum blues, right, 2 weeks after 1 week, usually postpartum blues will come after 1 week of delivery. After 1 week of delivery, for 2 weeks, sometimes for 2 weeks, we can have depression symptoms. Alright, but it considered as okay lagi lah. Postpartum blues is something that we don't treat. We usually observe first. Alright, but if it's ongoing for more than 2 weeks, and this person started to have other symptoms like psychotic symptoms. Psychotic symptoms is hearing voices, having delusion, then this person might have postpartum psychosis, alright, which is a more severe diagnosis. Or at this point of time, we really, this patient is going to be in our observation lah. We're going to give more attention to this patient. So when someone have postpartum depression, alright, or postpartum psychosis, at certain extent, alright, this patient is not going to be functioning. And even anak dia sendiri pun, they're going to neglect their own children, their own newborn baby too, they will neglect. Alright, which is uncommon for mothers. All mothers love their children. So if you know someone yang after deliver, they are not bonding with their child, okay, I have to find out lah whether this person have some sort of postpartum depression. Right. The next one is psychotic, alright, or we panggil depression with psychosis. Okay, depression with psychosis, okay, psychosis usually occurs when the depression is very severe. Okay, kemurungan yang sangat teruk boleh menyebabkan seseorang tu mengalami psychosis. Okay, so again, psychotic symptoms means this person will start to hear voices that is unthere. Okay, we call it hallucination. Might see something that is not there. Okay, that is visual hallucination. The previous yang dengar suara tu is auditory hallucination. Alright, this person might have some sort of delusion. Later on, I will say it more in schizophrenia, because schizophrenia also have psychotic symptoms. Alright, but in depression with psychosis, the psychosis usually circulate around the mood, meaning the hallucination or depression, or the hallucination or the delusion usually is regarding the mood. Alright, for example, if this person is going to hear voices, the voices is usually the voice yang mendown-downkan this patient lah, saying that you're not good, okay, better you just kill yourself, okay, what for you live, alright. So it's something, the hallucination or delusion is something that really makes that person down lah, right? Okay, next slide. Now, tanda dan gejala kemurungan or signs and symptoms of depression. Okay, if I'm gonna tell you one by one, alright, okay, we start first, alright. The first one is perasaan tidak berdaya dan menyerah, or we call it hopelessness or worthlessness. This person is gonna feel like uh he or she is not worth of anything. Okay, I don't have any hope. Alright, I can't do anything. Alright, and they started to have perasaan, the feeling of giving up. Okay, and there's nothing that I can do about it. Okay, totally hopeless lah. Alright, and the next one is kehilangan minat dalam aktiviti harian or lose interest. Okay, if previously there's someone likes to read or like to go out with friends or like to play soccer, like to play PS4 ke, alright, now they lose interest. Okay, they don't want to do things that they like. This is something that we call anhedonia, alright, losing interest. Okay, next one is perubahan selera atau berat badan. Alright, changes of appetite. So not necessarily just lose appetite, if increased appetite also might be a sign or symptoms of depression. Okay, usually how do we say there's a significant changes is in 1 month, 5% of increase or decrease of your weight, your original weight. Next one is perubahan tidur ataupun insomnia, right? Changes of the pattern of your sleep. It could be that someone having difficulty to initiate sleep, or that someone have issues to awaken, alright, able to sleep, but then sekejap-sekejap bangun, sekejap-sekejap bangun. So this person is going to be very tired the next day, alright. If one day it's okay, but it's ongoing for few weeks, okay. Then we have kemarahan atau keresahan, or we say irritability lah, right, increase of irritability. That at some point might cause aggressiveness, okay. Up to the point they might lose their temper, okay. Kehilangan tenaga, alright. We feel very tired, very exhausted, okay. Membenci diri sendiri, okay. Really hate themselves. Again, it's because you feel worthless, okay, that hopelessness, you ada self-hatred, okay. Tingkah laku melulu, this is what we call impulsive, alright. So impulsive, when we for those who have depression symptoms, okay, when their emotions, they feel overwhelmed with their emotions, okay, they feel overwhelmed with their thoughts, okay. Sometimes they just do things without thinking, alright. That's what we call impulsive. Okay, you feel like doing it, you just do it. This is what usually happen in self-harm also, right? Kalau you there's certain type of people like to harm themselves, okay, they feel angry, straight away they cut themselves, okay, because one, they don't think of what they're doing is having a big impact, or it's going to have consequences. Second is they feel like that way they will feel better by harming themselves, alright. Then we have concentration issues, okay, easily lose focus. This is where it will affect our functioning. So if someone works, for example, someone works as a teacher, okay, because of the symptoms that they have, they cannot focus on what they are doing. And the third one is ketidakselesaan atau kesakitan yang tidak dapat dijelaskan, or in what medical term kita panggil somatic punya symptoms lah, alright. Sikit-sikit headache, sikit-sikit gastric, okay, sikit-sikit sakit belakang, alright. This is what, like I mentioned before, mental health can affect our physical health, right? So this, if we see all these signs and symptoms at one point of our life, we feel, I have this also, alright. One time I have experienced this, but does this mean I'm depressed? Okay, usually, alright, we must have at least I think 5 or 7 of these symptoms. And then second is, all right, it needs to be more than 2 weeks duration. Right? If you only have this for like 3 days, okay, that doesn't mean that we have depression yet. But it's always uh advice for us, if you feel like you're having changes, better just to check with a psychiatrist or a psychologist first. Then you know for sure whether you have depression or not. Okay, the next slide.